Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So in today's video, I will walk you all through real world evaluation and management outpatient medical coding scenario. So this video will be especially helpful for fresher who have just been assigned to ENM project, or for anyone who wants to start their career with ENM outpatient coding. Okay, so in like we what I will do is I'm going to break down what to look for in the medical record, okay, and how to analyze the documentation, how to assign a correct ENM coding or procedure codes, or how to select the appropriate diagnosis code, and also I will give you certain information about the modifier usage and the place of service. Okay, all the basic necessary things I'm going to teach. So please do watch video till end, and if you find it useful, please do subscribe to my channel, and please also share with your medical coding friends. So let's begin. So in the screen you are seeing, so I have taken a scenario from outpatient or office setting, EMR, okay, electronic medical record. It's a dummy record, but this is exactly you are going to see, or like this is a replica of an actual medical record. Okay, so it will be useful for you once you start coding or once you get into floor. So firstly, it will start with the patient demographic. Okay, so you have this patient name here, age of the patient, and DOS. Okay, DOS refers to date of service. Here, sometimes few provider may document it as date of visit, and few may document it as date of service. The common thing is DOS, date of service, on which date they are performing the service. Okay, and next comes to location or place of service. Okay, where this patient is taking the service, that is very important, that you should thoroughly check where this patient took the service. So the location here is urgent care setting. Urgent care setting. So for this urgent care setting, you have to look for the place of service code. Okay, if you are already a certified, then definitely you will be aware what is the place of service code for urgent care facility or setting. We will check that place of service code later. And then patient type here, this patient, like established patient record. So in your software, you can check whether this patient is new or established based on the patient visit history. For our easy reference, I have just, directly gave you this patient is established patient. Okay, established means you know that like this is a first primary coding guideline for ENM OP. Okay, outpatient. You first have to check whether patient is new patient or established patient, because you have two separate codes. New patient code starts from 992 series 202 to 205, and established code starts from 99 to 11 to 99215. Okay. Anyway, 11211 is a nurse visit, so you can consider 99212 to 215. Okay, this code range belongs to outpatient or office setting, ENM, established patient category. So next, so to begin with the medical record, first you are going to see chief complaint. Okay, the starting of the record itself, you are going to see chief complaint. In short, we say CC. So what is chief complaint? Chief complaint is something that patient is expressing to the provider. Okay, the patient is telling what are the symptoms that the patient is suffering from, how many days that patient is suffering. Okay, so say for example, patient is having cough from last 2 days or headache from last 3 days. Likewise, all the symptoms that the patient, whatever the symptoms he is currently experiencing, he is informing to the provider. Okay, that information you will get under chief complaint. Next, history of present illness. So HPI. So HPI is something like like you will get a little detailed knowledge about each symptoms. Okay, so you can see in our scenario, patient reports. First, you can see the chief complaint. Chief complaint is patient is saying that she has a painful skin bumps on thigh and cut on her right forearm. Also, she has sore throat from 2 days. So there are three symptoms or a problem she is expressing or informing to the provider. Next, history of present illness. So here you will get detailed info about each condition. Patient reports two painful swelling on both left thigh and right thigh for the last 4 days. Okay, so she has painful swelling on both left thigh and right thigh, noticed redness and pus discharge from one of them yesterday. Okay, so like she is seeing that there is a pus, and she also says Denise fevers or chills. So remember, in your medical record, whenever you see the word Denise, okay, Denise refers to not there. Okay, it is she don't have, or she is not suffering from fever, or she is not suffering from chills. Okay, so Denise means she don't have fever, she don't have chills. That's what Denise means. Okay, but if she say reports or complaints that she has fever and chills, then you should consider that she is suffering from fever and chills. Okay, this word is important. So in your medical record, everyday basis, you are going to see this. Okay, if you already know this information, it will be easy for you to understand the project. And also present with 1.5 centimeter laceration on the right forearm, sustained in the morning while cutting the vegetables. So she also has 1.5 centimeter laceration on right forearm. What she was doing? She was doing like cutting the vegetables. When she was cutting the vegetables, she also got cut on her forearm. Okay. So next, bleeding controlled with the pressure at home. Additionally, patient complained sore throat and mild fever. So she is saying sore throat and mild fever for 2 days. And again, Denise, cough, shortness of breath, or runny nose. Okay, again you can just see Denise refers to she don't have cough, shortness of breath, or runny nose. So above they are clearly saying Denise fever here, and sometime they may say like mild fever under complaints, but again it is totally how the patient is telling. Okay, everything will be recorded and transcribed, so it's okay. Ultimately you will look for your final diagnosis. So next thing, after history of present illness, you are going to see the next section is review of system. Okay, in short, ROS. So here what do? They are going to check the systems. Okay, they'll just review the system and they will mention whether it is normal or abnormal. Okay, so just it's kind of reviewing. So respiratory, no cough, and musculoskeletal and skin. So as we know, there is a painful red swelling on thigh, laceration on forearm. So this is your abnormality. Okay, and for ENT, they have documented it as sore throat. Okay, so these two are your problems in current visit. Next, past medical history. Okay, this information is also important. So, past medical history before prescribing any medication or before starting the any kind of treatment, provider should review patient past medical history. So, under past medical history, they have given non-significant. So that means the patient has no significant past medical history. And currently, are you taking any medication? None. Okay, patient is not on any current medication. Allergies, so NKDA. So this is short. That means no known, no known drug allergy. Okay, so no known drug allergy. So that is also they have documented under patient medical history. Next, after that, you are going to see physical examination. In short, it is PE. So here also again, once again, they are going to evaluate the physical appearance. So general, patient is alert, mild distress due to pain. So how the patient is looking? Patient is alert. She's looking well, but she's kind of looking mild distress due to pain because she has the swelling, and because of that she looks little distress. And vital signs they have documented: throat, skin. Under skin you can see left and right thigh, two abscess present, right forearm 1.5 centimeter linear laceration. So everything they have given here. And after cardiac and respiratory, normal exam. So here under physical examination they can still add a little more physical appearance related to organ systems. So I just want you to understand how your record will look like. Okay, you will have the information about past medical history, you will have the information about physical examination. Okay, and then after physical examination, they'll come to procedure. So they have patient, informed what are the concern that she has. So provider is evaluating all those problem. Now in order to treat the problem, provider needs to perform the procedure. Okay, so under procedure section you are going to see what are the procedure performed in the current visit. Okay, so first procedure they have performed here is incision and drainage of multiple abscess. Why multiple abscess? Because patient had abscess on both the thigh, right and left, both thigh, bilateral thigh. Patient had abscess, so you are going to consider incision and drainage, IND procedure performing on both the sides. Okay, since both the sides, you consider it as multiple abscess. So they have given the procedure documentation here. See, they have did a local anesthesia. Okay, and both abscess incised and drained, and also patient tolerated the procedure well. Okay, so under each procedure, you are going to see the procedure documentation. Okay, so one procedure is done, you understood. One is incision and drainage. Okay, next thing, simple laceration repair. Simple laceration repair. So this is again, she had a 1.5 centimeter cut on her forearm, right? So for that, they are going to perform simple laceration repair procedure. So here, wound is cleansed with a saline and local anesthesia is injected, minimal blood loss, no foreign body, one layer closure with a four simple suture being utilized to close the laceration site. Okay, dressing is applied. So this is one more procedure. Lastly, they have performed one lab test, that is rapid strep test. Okay, rapid strep test. Why they have performed? Because patient was suffering from sore throat. Okay, sore throat. Because of sore throat, they have just wanted to check whether patient is positive for strep. So they performed rapid strep lab test, and the lab result comes out as positive. Okay, so you can see here positive result for rapid strep test. And whenever they perform labs, you should check for lab result. Okay, they should document whether the result is negative or positive. Same way, if they perform X-ray or ECG, they should also document interpretation of the X-ray and ECG reports. Okay, so if they are not documenting, then you can query the provider. If the lab test is missing, the result is missing, you can ask the provider, please provide the lab result for the particular lab. Okay, so they should attach the lab result later. Okay, without lab result, you should not process the claim. So here in our record, they have performed the rapid strep test, and they have also given the result. Okay, result is positive. So next, assessment. Assessment, you understood what are the problem that patient is having. So patient is having right and left thigh abscess, and patient is also having right forearm laceration. And lastly, since the strep is positive, you are going to consider it as a streptococcal pharyngitis. Okay, pharyngitis, itis, inflammation. Okay, so since the infection is present, like the strep infection is positive, you have to quote streptococcal pharyngitis as your diagnosis. Okay, so these are your diagnosis. Okay, diagnosis is nothing but problem being addressed at the visit. Okay, so next, the plan. What are the plan? So provider prescribed amoxicillin. Okay, prescription drug management he is performing, and he also given ibuprofen, and he told that wound care instruction is provided for both incision and drainage site and laceration. Okay, so general instruction provider given, and written in 2 days for wound check and in 7 to 10 days for suture removal. So he's just informing the patient about how to keep the wound safe, and other upcoming follow-up general instruction provider has informed the patient and documented it under plan. Next, time. So they have also documented here time spent. So how much time a provider has spent? Total time spent on the encounter is 35 minutes. Okay, 35 minutes is the total time that provider spent with the patient. And then in the last of the medical record, you're going to see the signature. So this record was reviewed and signed by the particular doctor or physician or a provider who have seen the patient. Okay, and also date and time is also documented. Okay, so now the same thing, like now you have to first see in medical coding software, since we have the like the bots implementation, they will suggest the codes. Okay, software itself suggest you the codes. Say for example, incision and drainage, here it will show what is a CPT code. Okay, and for laceration repair also it will show the CPT code. So what you have to do, you have to cross refer whatever they are choosing, that CPT is correct or not. Okay, and you have to apply all the coding guidelines. If it is correct, you are going to choose the same CPT, but if it is not correct, then you should change the CPT code which they have suggested, and you have to code it appropriately. Okay, so now as of now we have just seen the medical record. Okay, so now one by one we will code it. Okay, first we will identify what are the procedures. Okay, and what is the ENM level we will get. Okay, and what are the diagnosis, and what are the necessary modifier we need. Okay, later I will open the charge entry format and I will enter the codes there. Okay, so for now we'll start. So I'll show you the charge entry. So this is how your charge entry will look like. Okay, so here the serial number of the procedure codes, and then the next column is for procedure, next is modifier, DX pointer, okay, unit, price in dollar, POS, place of service, and which insurance is paying for the service. Okay, that also should be reflected. Okay, there is too much with the software, but for your idea, or to get a simple understanding, I'm showing in this way. Okay, so now to first we will identify our ENM level. Okay, so as you know to code ENM, office visit or other outpatient setting, what are the two coding guidelines we follow? We follow medical decision making coding guideline and time based coding guideline. Okay, so if you want to know what is MDM or a complete basic to advanced thing, just I will add the my previous YouTube videos, okay, in the description. Please go and check there. I've explained everything, the components of MDM and how to lead the final MDM level, okay, and what are the coding guidelines we have for MDM. Same way for time, both coding guidelines I have already explained in my previous videos. Okay, so in today's video I don't want to get into that particular info, so I'll just give you the overview. So in our documentation, the provider, at last, the provider was reviewed and he has mentioned 35 minutes spent with the patient. Okay, 35 minutes spent with the patient. So for established patient, in the initial itself, I mentioned our scenario was with the established patient. So for established patient, time is 35 minutes. So for 35 minutes, your level will be moderate. Okay, moderate final MDM you will get, or the moderate level you will get based on 35 minutes. So your ENM code would be 99214. 99214 will be your ENM level code. Okay, and also when you have both MDM and time supporting documentation, you have to choose the highest reimbursement coding guideline. So in our documentation, both are coming MDM. If you follow MDM also, you will get into certain moderate. But I am not going to review the MDM coding guidelines now. Just you can focus on time. Okay, let's understand any one guideline for current visit. Okay, so I'm taking time. So according to time, for 35 minutes, your level is 99214. So 99214. So let's enter this first ENM code 99214. Okay, so one CPT or one ENM service is done. Next, you have to come to your procedures, CPT. Okay, what are the procedures they have performed? So there are total 3 procedures they have performed. The first one is incision and drainage of multiple abscess. Okay, and for the region where the abscess are present, it is on thigh region. So now for incision and drainage, IND, so this falls where, in which system? Integumentary system. Okay, and simple laceration repair, again it is also skin related procedure. It is also from integumentary system. And rapid test, it falls for laboratory. Okay, labs. So now what we have to do, first we'll find out what is the CPT code for incision and drainage of multiple abscess. Okay, so I have coding software, but from book also you can easily able to navigate. But so far I'll just show you how to code it. So surgery, under surgery, the incision and drainage belongs to integumentary section. Okay, so you can just go and select the surgical procedure. Okay, so here you are going to see from 10040 to 10180, this particular thing is incision and drainage procedure on skin. Okay, so under that you are going to see 10060, 10061, 10060 says incision and drainage of abscess. Okay, for skin level. So it includes simple or single, simple IND or single site abscess. Next, 10061 says incision and drainage of abscess, complicated or multiple. Okay, so if assume they are performing incision and drainage single site, but it is complicated procedure, so that time you would have selected 10061. But in our documentation they are performing simple IND only. Okay, there is no complication there. But how many sites? There were 2 sites being performed. Okay, incision and drainage performed on 2 sites. So based on that, you should consider multiple IND, multiple incision and drainage performed. So you should code 10061. Okay, this is your CPT. So now code 10061 as your second procedure code, 10061. Okay, so next, coming to simple laceration repair. So here they have also told you, or gave the information like what kind of repair it is. Okay, so let's check the code for simple laceration repair also. And what is the site? So simple laceration, where was the cut? Cut is on the forearm. Okay, that means it is on extremity. So now I will check the code for this. So see here, If you check the code range between 1 minute. Okay, this is skin tag. 1 minute. Okay, so let me go and check. It is the procedure. Okay, so here is the index 12001 and 16036 surgical repair of closure procedure on integumentary system. So I need repair. So I am taking the repair. See, I am using this detailed format. Okay, just to make you understand how the procedure breakdown or how to navigate the codes. Okay, easily if you go by direct CPT code, you will get the description and you can enter. But I'm taking time and I'm just, giving you the map. Okay. So now I have clicked on surgical repair closure procedure on integumentary system. Under that, as you already know, the repair was simple suture or simple laceration repair they have performed. So you can see under repair, there are three types. One is simple procedure, one is intermediate procedure, and one is complicative or complex procedure. So you want simple repair. So click on here. Okay, so the first code itself 12001 says simple repair of superficial wounds of skull, neck, axilla, external genitalia, trunk, or other extremities, including hands and feet, 2.5 centimeter or less. Okay, and the codes will vary based on the centimeter of the wound, also anatomical sites of the wound. So now in our question or in our documentation, the wound was on extremity, that is forearm, and the wound length was 1.5 centimeter. Okay, which is 2.5 centimeter or less. So in this code range only you will get. So this particular code, you will code up to 2.5 centimeter or less than that. Since you have 1.5 centimeter, your correct CPT code is 12001. Okay, so let me add 12001 also. Okay, so next thing is rapid strep test. So they have already given 87880 as a CPT code. So sometime they'll suggest the code. So you have to cross check whether 87880 is correct for rapid strep test or not. Okay, so let me check that also. So just you have to again go back to, so let me go to labs. Okay, so you know the labs. So pathology and laboratory procedure. Okay, under that you should check here. So just check 87880 is correct or not. Okay, so you can see here. So 87880 is immunoassay with a direct optical observation of Streptococcus group A. Okay, so this lab is correct for strep test. Okay, 87880 is the correct CPT code which I have suggested. Okay, so also under that they're also saying this is a clear wave test. Okay, so clear licensed. So here you should know one modifier will come. So later we'll see that. So as of now, 87880 you got it for your rapid strep test. So let me enter 87880. 880 also. Okay, so now you are done with your procedure codes. The next thing is modifier. So now you should know what are the modifiers are applicable for this scenario. So you have the ENM code. Along with the ENM service, there is a significant separately identifiable services are performed. Okay, there is a procedure and there is a ENM also. So then you should understand. So I'll just show you the modifiers also. Okay, so see which modifier is applicable. 25. 25 modifier, you have to give it with ENM code because significant procedure, significant separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. Okay, so they performed ENM along with the significant procedure and both were performed by same physician on the same date of service. Okay, same session. So 25 modifier is must and should. Okay, so let me use 25 modifier with my ENM code. Next thing is, what is the next thing? There are two CPTs here, procedure to procedure, 10061 and 12001, and there is one more modifier is required to have this clean climb. Okay, so that modifier is 59, distinct procedural service. Okay, so you should inform the insurer by using this modifier, and like you should make it, these are not a bundled service. Okay, only utilizing modifier you can reflect this info to the insurer. Okay, so now as you know about NCCI edits, so there are edits applicable between these two CPT codes. So as you just, I'll show you that also. So go to NCCI edits. Okay, National Correct Coding Initiative, procedure to procedure, PTP edits we say, or CCI edits. So now whenever you check the edits, these are your indicators. If you get 0 as your indicator, then utilizing even with the modifier, you cannot build those two CPT together on same session. Okay, even if you are using modifier also, you cannot use the two procedures together. Okay, when you get your indicator as 0. But if your indicator shows 1, then there is an exception may apply. Submit the appropriate modifier to bypass the edits. Okay, so what is NCCI also I have explained in my previous video. That link also I will add in the description. Go and check please. Okay, there I have explained what is column 1 CPT, what is column 2 CPT. Okay, and what are the circumstances we have to use the modifier, and which modifier is applicable to use to bypass the edits. Okay, so 59 modifier is applicable to bypass the edits whenever it shows 1. Okay, and again further, if the claim get denied, and for Medicare payer, we are going to use X series modifier. Okay, instead of 59, we will use XC, XS, XP, XQ based on the scenario. Okay, that all, it is too much to understand. So as of now, just see, here I am just giving 10061 because we have this code in our documentation. So with this, which modifier I should use, or for which procedure I have to use my modifier is the concept. So major code is 10061 here, minor code is 12001 here. So what the modifier shows, or the indicator showing 1, that means you can use 59 modifier to bypass these two CPT edits. Okay, so I will go and use 59 modifier with my minor procedure or column 2 procedure. Okay, so as you can see on the screen, 12001 was showing in the column 2, that was minor procedure criteria. So there I am using 59 here. Okay, and for 87880 I have to use QWO modifier. Okay, clear wave test, QWO modifier. Okay, so these are the modifiers are applicable for this particular scenario. Next thing, dx pointer is there, and unit refers to how many times you are billing this particular cpt code. Okay, each cpt you are billing it once, so you have the 1 unit, and this is like random dollar value associated with a particular procedure code. So you can just have this example. Next is POS, place of service, where they perform all of these services at urgent care setting. Okay, so come to place of service uh, table. So here you have the place of service. So you can see here place of service code. See place of service name and the code for urgent care facility. 20 is the place of service code. Okay, so let me enter that also. 2020 all services performed at the same setting, so you should show it with the place of service 20. So if it was any somewhere else, okay, if it was office visit, then you would have added 11 here, okay, according to the code. So see, 11 is for office. Okay, but now we have urgent care facility, so you are coding with 20 as your place of service code. So next thing, see, insurance is BCBS. They have just allocated this. Coming to DX, diagnosis. Now you have to code for diagnosis. So let me make it very clear or very simple. So what was the scenario? I mean, what was the medical conditions we had? We had left and right thigh abscess. Okay. So for this, you have to go and check the abscess, and you should look for the anatomical site. Okay, so let me just like in the codify also it will be visible, but still I will go with the free service because you people cannot access the whatever the codify I am showing now. Okay, this is a paid service, so let me go with the free service so you can also check. Okay, so I know the code, that's why I'm entering. Okay, just select up to category code or subcategory. So see, abscess, cutaneous abscess of limb. Okay, under this you will be able to see all the related codes. Just go and check the greater level of details. So here you have all the codes, and our location is thigh. So thigh falls in the lower limb. Okay, so cutaneous abscess, right lower limb, cutaneous abscess, left upper limb. Both lateralities specifications we have here, but we don't find any bilateral code. Okay, if we don't have bilateral code, then you can code them separately according to the laterality. So these two codes are correct for our abscess scenario. So let me note down that L02416 and L02415. Okay, these two diagnoses. Next is, okay, first I think I have already noted down, but still I will just, for reference, I'll keep it L02415 and L02416. Okay, we are done with the abscess diagnosis. Next diagnosis was patient had laceration, right forearm laceration. So just we'll check directly right forearm laceration code. So laceration with foreign body, without foreign body. So in our scenario, foreign body was not there. Okay, it was just a knife cut. So without foreign body, you have to select laceration without foreign body of right forearm, initial encounter. Okay, your character, 7th character should be A because it's an initial visit and the first stage of treatment, initial encounter. So S51 811. This code is for your laceration procedure. Okay, so lastly you have one more condition, that is positive strep. Okay, positive strep is streptococcal pharyngitis. Only if they mention pharyngitis or acute pharyngitis, then it goes for negative rapid test. But whenever the lab test is positive, you should show it with the streptococcal pharyngitis. Okay. So streptococcal pharyngitis code is ICD code is J02.0. J02.0. Okay, this is the streptococcal pharyngitis code. So let me note down that also. Okay, so all of these codes are diagnosis codes, and one more code is applicable here. Since you have the laceration code, okay, you should look for the documentation. So in the history of presenting illness, remember, whenever you are seeking external cause code, it will be, most of the time it will be documented in HPI. Okay, so here if you observe, patient present with 1.5 centimeter laceration on right forearm, sustained in the morning with while cutting the vegetable. Okay, what was her external, I mean action for the particular condition? When she was cutting the vegetable, she got cut. Okay, so here just, let me take or let me add a scenario like she got cut with a knife. Okay, so knife. So if knife is documented, what you will do? If knife is not documented, you have to code with contact with some sharp object, unspecified sharp object. Okay, but knife, assume since she is cutting vegetables, knife is the thing. Okay, so I am just adding that now, knife. So knife means you have to select the external cause code for contact with the knife. Okay, contact with knife. So that will give information. CW. Okay, so you can see. So W26.0, contact with knife, initial encounter. So as you know, whenever you are coding your current condition, like laceration, you coded with the last character A. So then the respective external cause code for the laceration should also go with the character A. Okay, that is important. So you should again take the code as W260XX-A, contact with knife. Okay, initial encounter. So now this is one more diagnosis we got in the medical record. So let me keep here. So now we have to assign this DX pointer in this particular column. Okay, here. So just give me a 1 minute. I will arrange and I will reshare the screen. Okay. So I hope my screen is visible. So see now. So pointer, DX pointer is something you don't directly enter the ICD here, but instead you will enter the number or the alphabet. Okay, which is, like for example, here I have added A. A refers to L02416. B refers to L02415. Okay, so likewise, I think here I made one, just a minute. So L02415. Okay, 415 is for right lower limb. Okay, so just I'll rechange this. L02415 is right lower limb. L02416 is left lower limb. Okay, so while copying, I've just mismatched. It's okay. So next, laceration code is there. Streptococcal pharyngitis code is there. And lastly, external cause code. So all of these having the reference alphabet here. So now for evaluation and management, you can use all the four because they have evaluated. The patient is being evaluated for abscess also, so you can use A, B, and laceration also, and pharyngitis also. Okay, so you can keep your reference as A, B, C, D. That means this ENM code is responsible for all of these four diagnosis evaluation. Next, 10061, this is only for abscess. Okay, so whatever the digits or the pointers we keep here, that will define the medical necessity. Now, as you know, this is incision and drainage CPT code. So incision and drainage CPT medical necessity is abscess. Okay, so you should only enter A and B. Okay, cutaneous abscess on right lower limb, cutaneous abscess of left lower limb. That's it. Next, you have the laceration. Laceration procedure, why they performed? Because patient had a laceration on right forearm. Okay, so you should only enter or you should only link the laceration diagnosis for 12001. Same way, lab test, strep test they performed. Why? Because to evaluate the pharyngitis. So you should only enter the reference pointer D. Okay, so like this, you have to code in your charge entry. This is exactly how you will get an ENM outpatient records. You will have the ENM and you will have any minor outpatient procedure along with the ENM. So know the modifier importance, 25 modifier importance, know the 59 modifier importance. So here you should think about medical necessity, modifier usage, and for particular modifier, look for the CCI edits. Okay, and procedure documentation, and any respective coding guidelines are there. Okay, so when you start working, you will have the payer specific coding guidelines and provider specific coding guidelines. All of those they will teach you. Okay, but as of now, this is exactly how your medical record will look like. So once you start, your initial days will be, they will give you some sample charts, and they will ask you to just, select. They'll not give you software, but they will ask you to write down your CPT codes and ENM codes, what you have analyzed in the record. Okay, so if you watch this video, definitely, if you, upcoming month, if you're going to any ENM project, you will able to understand everything very easily. Okay, so remember whatever the points I have discussed in the current visit, and in the current session, and I hope this video is helpful for you as a fresher, and even if you are experienced one, or if you want to have ENM guidance. Okay, like say for example, you are working in HCC but you don't have idea on ENM coding, so it is also beneficial for you also. Okay, so now you have an idea how we code. Okay, so same way, if you want many more charts to be discussed, please do share my video with your friends, and please do comment. Okay, so it is very important to have to curate these things and to explain all of these things. So please, what to say, I just need your support, and that's all I think. And also CPC exam preparation, new batch will be starting from September 10th. Okay, whoever preparing for exam and going to write anytime soon, then you can join the live classes. Okay, so yes, that's all for today's session. If since it is a live recording session, if any kind of mismatches are there, just you can get back to me, or you can comment. Okay, so I hope everyone will understand. So I cannot take any retakes here, it's a pure live recording. So yes, I have explained how it looks and what are the key points you should look in the medical record, everything. So like upcoming days, I will take few other scenario sample, or maybe for other projects also. Emergency department also, I know I will do that, and pathology, I know I can do that. In few other projects, I have whatever I am aware, or I have worked, I have experience, I will do the live charting sessions. Okay, So that's all, guys. Thank you for watching. If you have really watched this far, and I really hope this video is really helpful for you. Thank you all.